Hi everyone, Dr. Oommen and I are back answering more of your coronavirus questions. As some of you may have seen, the amount of cases have gone up quite a bit in Quebec. So we've increased our cases by about 300 since yesterday. So I think it's safe to say that we're entering this realm of community spread. So what does community spread mean? It means that we're transmitting and spreading the virus from person to person, and people are not sure where they're getting it from. So it's not a clear story of I traveled here or I specifically came in contact with this person. And the scary part as well is that most of these cases are in people under the age of 65 and are asymptomatic. So specifically, these people need to now up their guard. So every time you step outside, you should safely assume that about 50% of the people you encounter will have the coronavirus. So this is our reality as of today. With that in mind, let's get started with the questions.
Thank you, Dr. Liello. So the first question I have, I found very challenging and more complex than it seems on the surface. So let's get into it. Since it seems like a large number of people are going to get the coronavirus, and we know the following to be true, that epidemiologists are saying once you have the virus, it's unlikely that you'll get reinfected, that some kind of herd immunity is needed in order for the pandemic to pass, that most people will have mild symptoms and won't be hospitalized. So why are we so afraid? Would it not be better to just get it and get it over with? And obviously staying away from those who are more vulnerable during that time. So what a great question. Let's break this down. The first part of the question is, a large number of people are going to get the coronavirus. Okay, that statement is true. Like Dr. Liello just finished explaining, we anticipate about 50% of the population to become infected. Second part of the question, it's unlikely that you will get reinfected. That also seems to be true. So to the best of our knowledge at the moment, we would say that once you get the infection, you have enough immunity or protection that you're unlikely, very unlikely to get reinfected. Yes, there are some exceptions to the rule, like everything in medicine, and we're learning as we go. But for the most part, we think once you're infected, like many viruses and the cold, you tend to be protected. And the third is the most important concept I think we should spend some time talking about is herd immunity. What is that? So herd immunity is a form of indirect protection from infectious disease that occurs when a large percentage of a population has become immune to an infection. So how do you become immune? Basically, there's only two ways. One is through vaccination, and the other is by getting the disease. So the concept is that either way, you either develop natural antibodies through a natural infection, or you have a vaccine ready that builds up your antibodies that's going to protect you. And Dr. Liello, if it's okay with you, I'd like to take a little detour here into the history of vaccines. I thought it might be interesting for our audience. So the first vaccine was actually developed in 1798. Many of you will know that was over 200 years ago. That was the smallpox vaccine by Dr. Edward Jenner. And the WHO, the World Health Organization, declared that smallpox was globally eradicated in 1980. So that was just only about 40 years ago in most of our lifetimes. And the estimates are wide, but it killed maybe from 500 million to 1 billion people over the 200 years or so since the development of the vaccine. So it took 200 years of hard work and vaccine and talking to the world and working hard on getting people vaccinated to eradicate the disease. So it would have been really good if we had a coronavirus vaccine right now. So back to herd immunity. So again, the estimate is that if 60% of the population had a herd immunity that we could seriously bring to an end this current pandemic. That is linked to the R naught, which Dr. Liello, could you just remind us again?
So again, it's how quickly the virus spreads. So the R naught for the coronavirus is around 2.2. So any one person that's infected could give it now to 2 other people.
So based on that, if we had 60% of the population immunized in some way, that would hopefully bring to a close this pandemic. Now, ultimately, herd immunity will happen at some point in the future, since neither the pandemic nor social isolation can go on forever. And the point is that while we're waiting for this herd immunity to happen, either through the vaccine or through the natural acquisition of the disease, all the governments are working to minimize the loss of life in the meantime. So let's answer the question. From a medical standpoint, we would say no. We would not want any individual to undertake the risk of getting this naturally and getting natural immunity, because at this moment of the pandemic, we don't know enough about who's going to die from it. So that would be too much of a risk to say on an individual basis, let's go that route.
I agree. It's way too much of a risk at this point. And it brought up a really good point about developing immunity as well. You'll hear a lot of people that'll start talking about building up antibodies and could we measure the antibodies. It's really interesting. One thing to note that hasn't been said a lot is that just having detectable antibodies. So now you had the virus and we do a blood test when you're better and see that there's antibodies again. It doesn't necessarily mean you're immune. So if we take, for example, HIV, there are some patients that have HIV, they'll have detectable antibodies, but it doesn't mean that they're immune to HIV. So there has to be proof, which we haven't received yet, that developing the antibodies means for sure that you're protected. So it's just an interesting point. So another question that we got that I thought was really interesting. So what do we know about blood pressure medications and the coronavirus? So we're hearing more and more concerns about certain blood pressure meds and how that it may affect the coronavirus. Specifically, people are talking about the medications, they're called ACE inhibitors and ARBs, which are very, very commonly prescribed blood pressure medications. It was initially brought up by this research letter in the Lancet, and in fact the letter was just looking at whether people with high blood pressure or diabetes are at higher risk for the coronavirus. And then they secondarily kind of hypothesized that it may be blood pressure medication that could adversely affect those with the coronavirus. I don't want to get into the nitty-gritty details of why this was brought up, just because I'm afraid that it may complicate the matter further, and I want to be absolutely clear when it comes to this. So, yes, if you do have high blood pressure or diabetes, you tend to be in a little bit more of a vulnerable category. And yes, most people that do take these medications are a bit older and are automatically in that vulnerable category. But if you look at some statements that were released by multiple medical associations, so we have the European Society of Cardiologists, the UK Renal Association, they all stated kind of clearly that this thing that people are saying about the blood pressure medication, there's no sound or scientific evidence to support it. So to be clear, I strongly recommend that you continue your treatment with your usual antihypertensive medications.
You know, I have a number of patients on my desk right now that asked the same question. I would agree 100%.
Yeah.
I have another question here, also interesting. The Gazette is delivered to my door every day. I keep wondering if it's safe to touch it, which I'm doing while eating my breakfast. I've been wondering about canceling the paper version, which I love, and settle for the e-Gazette. I still love to read and touch a real book, magazine, and newspaper. So very good question. Again, many different people have asked different angles on that. So the answer is, at this moment, we would say that the risk of transmission through this fashion would be extremely low. Yes, we know that it can exist on surfaces. Yes, we know that we want to keep washing our hands, but I would say that droplet transmission through the air is probably more and more likely as we learn about this particular virus. So that 6-foot parameter when you're talking to people would be the key. Now, if you can get the e-Gazette, go ahead. I think that's the safest route. Or at least if it's the paper Gazette, read it when you're not eating. And like we always say, if you're going to go that route, wash your hands before you eat. Wash your hands after you eat. Wash your hands before you read the Gazette and after. Just keep that mantra in mind and we'll stay safe.
That's perfect. I think I have a very, very similar question.
Okay.
So is it safe to be ordering food delivery from restaurants or caterers or food delivery services? Or is it just safer to buy groceries and prepare the food ourselves? So similarly, up until now, there's no evidence that the coronavirus is transmitted through food. And if you look at some studies looking at other viruses, it doesn't look like they tend to survive on food surfaces. The droplet it's really the highest risk. So like Dr. Rubin was saying, you're more likely to get the virus in dealing with the actual delivery person than you are through your actual food. So one strategy would be to pay online and then leave a comment to just kind of leave the food at the door and ring the doorbell. That way you minimize that communication. Same thing, we have to worry about the packaging perhaps, because as I mentioned in previous videos, we know that the virus could live on certain surfaces like cardboard, which we tend to see most kind of food delivery packaging in. So what I would do is, first of all, if you can, try to deal with all the food prep yourself. But if you do have to order out, so once you receive the package, I would remove all the food from its kind of cardboard packaging, throw that or recycle that, wash your hands and then eat. That way you're minimizing the transmission.
Great tips. Here's my next one. My husband was in the Dominican Republic. He arrived on Saturday and now he's quarantined for 14 days. Once he finished this quarantine, does he have to get checked? If he doesn't have the coronavirus, when could we welcome him back home with no worries? So another great question. Listen, if we were in a perfect world, yes, we would be checked before quarantine to see if he actually needs to be in isolation for 14 days and after, but the world is imperfect and it'll never be perfect. So I would say at this point in time, the isolation, the self-quarantine is the right way to go. And I don't believe we have the testing capacity to test everyone after the 14 days. So we assume that if the patient developed no symptoms, that they're okay and they're free to leave their house. But remember, the general rule is, for the most part, for all population, we're requesting everybody stay indoors except for emergency groceries, gas, pharmacy, and maybe medical emergencies.
I think one day we'll get there in terms of being able to test everyone. But I agree, same thing, like right now we can't, but so we'll assume that you don't have it after that 14-day window. One of the questions, actually the last question I got here. So I was extremely ill at the end of January, 5 days of fever, aches, soreness, throat pain, chest heaviness. My entire family got it. Is it possible that this was the coronavirus? I haven't been sick like that ever. So in fact, this really just sounds like the flu caused by the influenza virus. This is exactly how people describe it. You wake up, you feel like you got hit by a bus. Your muscles ache, everything hurts, your head, you have fever. And just based on the timing of this happening in January, it seems like it was more the influenza. The first cases that we were getting of coronavirus, which happened in BC, were in about mid-February. And given that we know how quickly this thing spreads, if it was the coronavirus and you weren't self-quarantined, we would have likely seen a peak of cases in Quebec a lot earlier than we have. So it really does it is the flu, and that's why we try to vaccinate to protect against it, because it's not a pleasant thing.
Dr. Liello, this reminded me of the first concept that we touched on, herd immunity. That concept of if enough people in a population have antibodies against the coronavirus, it kind of blocks the transmission from going from one to the other. So I was thinking, if everyone here even did have the coronavirus, they kind of have in their family a micro herd immunity that protects each other. Of course, not big enough the minute they go out into the larger community. They may still have that protection, but we don't want that spread to happen also. So I thought that was a micro kind of herd immunity. And I think we'll leave it at that then. I'd like to let's take care of everyone, take care of yourself, and be safe.